Welcome to Anatomy DAHAR series. Today's topic is nerve supply of the tongue. Illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Nerve supply of the tongue. The tongue is entirely made up of striated muscles and covered by mucosa. An adult human tongue is 7.9 cm to 8.5 cm in length and about 5 cm at the widest part. Although the tongue is relatively a small structure, it takes part in most types of function, both motor and sensory, and thus it is supplied by many nerves. They include two main groups, A. motor and B. sensory nerves. A. motor. Motor nerves are again subdivided into two types. A1. Somatic motor for the contraction of the striated muscles of the tongue for the voluntary movements. And A2. Parasympathetic, that is secretomotor for the involuntary secretion of the glands of the tongue. B. Sensory. It is again subdivided into three groups. B1. General sensory for pain, temperature, touch and pressure. B2. Special sensory, gustatory function for the taste of sweetness, salty, sourness, bitterness and umami taste. B3. Proprioceptive sensory from the stimuli within the fibers of the muscles of the tongue and the tendons of the tongue. Motor innervations of the tongue muscles. This is the embryo seen from the right side. This is anterior or ventral. This is posterior or dorsal. These are the somites along the dorsal border. This is thoracic somite, cervical somite, and these are occipital somite. A1. Somatic motor. The tongue consists of two groups of striated muscles, intrinsic and extrinsic. Both groups derive from the myoblast cells originating in the occipital somite, which are located in the occipital region at the back, far from the final location of the tongue, which will be in front. The occipital somite received nerve supply from the hypoglossal, that is the 12th cranial nerve. Therefore, all the intrinsic and extrinsic muscles of the tongue are innervated by hypoglossal 12th cranial nerve, except palatoglossal muscle. Migration of the myoblast cells. The diagram is a blood vessels and few cranial nerves. Posteriorly, that is on the dorsal side, myoblast cells from the occipital somite. In front is final locations of the tongue. B. The myoblast cells from the occipital somite A migrate ventrally, that is anteriorly, and invade the tongue rudiments B in the floor of the mouth and form the tongue in front. The migration of the occipital somite drags its nerve, that is the 12th cranial nerve, hypoglossal nerve, along it. However, the palatoglossal muscle is developed from the mesoderm of the 4th pharyngeal arch. It is being essentially a palate muscle. Hence, it is supplied by the cranial accessory, that is 11th cranial nerve, through the pharyngeal plexus via vagus, that is the 10th cranial nerve. Injury to the hypoglossal nerve, resulting in the paralysis an atrophy of all the muscles of the tongue on the affected side except the palatoglossus muscle, which is not supplied by the hypoglossal nerve. The tongue deviates to the paralyzed side during protrusion because of the action of the unaffected, that is normal genioglossus muscle on the other side, which is protruding the tongue. So, affected side, the muscle cannot protrude, so the tongue will be deviated to the affected side. A2. Parasympathetic, that is secretomotor supply. Posterior one-third of the tongue consists of scattered, isolated nerve cells. They are involuntary postganglionic parasympathetic neurons innervating the glandular tissues and non-striated muscles in the blood vessels of the tongue. B. Sensory innervation of the tongue. B1. General sensory for pain, temperature, touch and pressure. Reflects its embryological development. The anterior two-thirds of the tongue. This is the one. It is supplied by lingual branch of the mandibular nerve, the nerve of the first arch, except the pre-sulcal area of the velate papillae. This is the pre-sulcal area of the velate papillae. So the rest anterior two-thirds is supplied by the lingual branch of the mandibular nerve. Posterior one-third, this is the one. Posterior one-third of the tongue and pre-sulcal area, this is the one, of the velate papillae are supplied by the glossopharyngeal nerve, that is the ninth cranial nerve, the nerve of the third arch. This is the one. Most posterior part of the tongue and the epiglottis are supplied by the internal laryngeal branch of the superior laryngeal nerve, the nerve of the fourth arch. So this is the most posterior part, will be supplied by the internal laryngeal nerve, which is the branch of the superior laryngeal nerve. The posterior one-third is supplied by the glossopharyngeal nerve, not only posterior one-third, and pre-sulcal area together will be supplied by the glossopharyngeal nerve, that is the ninth cranial nerve. Anterior two-third, not including pre-sulcal area, is supplied by the lingual branch of the mandibular nerve, that is the nerve of the first arch. Finer points 1. During the development of the tongue, 3 mesenchyme swellings, tubercular impar, and 2 lateral swellings of the first arch fuse and develop anterior two-thirds of the tongue. Therefore, general sensory of the mucosa of this area is supplied by the nerve of the first arch, the lingual branch of the mandibular nerve, except the pre-sulcal area of the velate papillae. Posterior one-third of the tongue originates from the second, third, and anterior part of the fourth arches. This is second, third, and anterior part of the fourth arches. Because of overgrowth of the third arch, over the second arch and slightly beyond the sulcus terminalis, the general sensory of the posterior one-third of the tongue, together with the pre-sulcal area of the velate papillae, are innervated by the nerve of the third arch, that is glossopharyngeal nerve, ninth cranial nerve. This is the area, posterior one-third and pre-sulcal area. The extreme posterior part of the tongue and the epiglottic area are developed from the posterior part of the fourth arch. Hence, they are supplied by the internal laryngeal branch of the superior laryngeal nerve, the nerve of the fourth arch. B. Sensory innervation of the tongue. B2. Special sensory. The gustatory is for sweetness, salty, sourness, bitterness, and umami taste. Taste sensory in anterior 2/3 of the tongue is detected by cauda tympani branch, that is pre-traumatic nerve of the first arch, from the facial nerve, that is post-traumatic nerve of the second arch. Please see final point 2 below. Taste sensory in the posterior 1/3 of the tongue is detected by the glossopharyngeal nerve. In the most posterior part, the taste sensory is detected by superior laryngeal nerve. Here you can see taste sensory in anterior 2/3 is detected by the cauda tympani nerve, branch of the facial nerve, and posterior 1/3 taste is carried by the ninth cranial nerve, that is glossopharyngeal nerve. Most posterior part taste is detected by superior laryngeal nerve. Find points 2. The mesenchyme of the primitive pharynx developed 6 pharyngeal arches on each side. They are numbered first to 6 arches from superior to inferior. Out of the 6 arches, the 5th arch disappears early. This is the pharyngeal tube, primitive pharyngeal tube. These are the arches. Actually develop 6 arches at the beginning, but 5th arch disappears early. So this is first arch, second arch, third arch, fourth arch, and 6th arch. Each remaining arch is characterized by its own musculature components supplied by own cranial nerve. The nerve of the first arch is mandibular, that is the 3rd division of the trigeminal nerve. The nerve of the second arch is facial, that is 7th cranial nerve. The nerve of the 3rd arch is the glossopharyngeal, that is 9th cranial nerve. The nerve of the 4th arch is a branch of superior laryngeal nerve, and the nerve of the 6th arch is recurrent laryngeal branch of the vagus nerve. So these are the arches, number 1 to 6, but number 5 is already disappeared. Externally, if you see from here, the arches are separated by cleft called tremor. These are the cleft between the adjacent arches. So they are called tremor. Pre-tremor means before the cleft, and post-tremor means after the cleft. Externally, if you see from outside, between the 2 adjacent arches, there is a cleft called tremor. Each arch below the respective cleft is called post-tremor. Its own nerve is the post-traumatic nerve, which runs along the upper part of the arch. The arch above the cleft is pre-tremor. Pre-tremor means before the cleft, and post-tremor means after the cleft. Post-traumatic nerve, or nerve of an arch, gives special sensory branch, which crosses the cleft above it and runs along the lower part of the arch, one above it. You can see here, this is the second arch, this is the first arch. The main or own nerve of the second arch, facial nerve, will give a special sensory branch called the tympani nerve, which crosses the cleft above it and runs along the lower part of the first arch. The pre-traumatic nerve in adult or in post-birth appear only in the remnant of the first and the second arches. see first and second arches in the diagram. I've already shown already. So the main nerve, facial nerve in the second arch will give a special branch called the tympanic nerve, which will go to the arch above to supply anterior 2/3 of the tongue for special sensory taste. So the anterior 2/3 of the tongue is developed from the first arch. However, its pre-traumatic nerve for taste is the caudal tympanic nerve, a branch of the facial nerve from the second arch. Therefore, the taste sensory at the anterior 2/3 of the tongue is supplied by the caudal tympanic nerve, but its general sensory is the nerve of the first arch, that is the lingual nerve coming from the mandibular division. Locations of the basic taste. Various taste areas are located on the dorsum of the tongue as follows. Sweetness, number 1, at the tip, that is apex of the tongue. Salty, number 2, at the lateral margins of the tongue. Sourness, number 3. And bitterness, number 4, at the posterior part. And umami, number 5, on widespread area of the tongue. Umami taste is produced by glutamate, inosinate from meat and fish, and guanylate from dry mushroom. Umami taste is synergy with monosodium glutamate (MSG). It spreads all over the tongue, lasts longer, and facilitates the secretion of saliva. Taste sensations are carried through the respective nerve to the nucleus of tractus solitarius (NTS), that is the nucleus of the taste in the medulla. Please see next slide. Nerves carrying taste sensation from the tongue. This is left lateral view of the tongue. This is tips. This is root of the tongue. This is sulcus terminalis. In front is velate papillae. This is anterior 2/3 of the tongue. This is posterior 1/3 of the tongue. This is most posterior part of the tongue. Nerves carrying taste sensation from the anterior 2/3 of the tongue, except from velate papillae area, is carried by caudal tympanic nerve, which is the branch of the facial nerve. It accesses through the geniculate ganglion of the facial nerve and finally to the nucleus of tractus solitarius in the medulla. Taste from posterior 1/3 of the tongue, including pre-sulcal area in front of the sulcus terminalis, are carried by glossopharyngeal nerve, that is 9th cranial nerve. Then passes through the inferior ganglion of the 9th cranial nerve to the nucleus of tractus solitarius (NTS) in the medulla. Taste from most posterior part of the tongue and the epiglottis are carried by internal laryngeal nerve, which is a branch of superior laryngeal of the vagus. Then through the inferior ganglion of the vagus to the nucleus of tractus solitarius in the medulla. After relay at nucleus of tractus solitarius, passes through trigeminal lemniscus to synapse at postero-ventromedial (PVM) nucleus of thalamus of opposite side. Finally to the lowest part of the postcentral gyrus, the final taste center in the cerebral cortex. P3. Proprioceptive sensory. This is the third type of the sensory. Proprioceptive sensory of the tongue is for stimuli from the muscle spindles within the muscles and tendons of the tongue. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available. Anatomy DAHAR series also provide other videos related to the present topic. Enjoy. Thank you.